I'm Margaret Bennett, Chief Executive of Southern New South Wales Health, and I'm pleased to have a couple of minutes to connect with you about a fabulous role I'm recruiting to at the moment. And this is the Executive Director of Operations for Southern. Effectively, it is the Deputy Chief Executive. So I'm going to talk a little bit about Southern, and then I'm going to talk a bit about where we're at the moment in Southern. Importantly then, focus on the attributes of this fabulous person that I'm looking for, and finish up with what it is that I can offer you. Southern New South Wales is in a spectacular part of the world. We look after 45,000 square kilometres. We surround the ACT on 3 sides. Southern encompasses the traditional lands of 4 Aboriginal nations. We stretch from the tablelands in the north, Yass, Goulburn and Crookwell, swooping across to the Eurobodalla coast at Bateman's Bay, all the way down to the Victorian border, inland then to the magnificent snowy Monero region, back up then to Queanbeyan and out to Braidwood. So living here and working in this district provides you with a tremendous lifestyle. And in normal times, Sydney is easy to get to, as is Melbourne. And of course, surrounding ACT on 3 sides, you have open to you all that Canberra and the ACT has to offer. So it's a pretty wonderful place to live and to work. Our service delivery is organised across 20 main sites. Of course, on top of that, we have very significant community and virtual care delivery as well. We've got 3 main networks, and so the tablelands in the north across to the new coastal network and then the Monero network. And on top of that, our services include the 2 major streams of integrated care along with mental health, alcohol and other drugs. We have about 4,000 staff and VMOs providing support to our district, working in incredibly committed and united service every day in Southern. And on top of that, we are incredibly well supported by a huge team of volunteers. It's important for me to note that our community and our staff have been through so much in recent years, and this is an important backdrop for anyone coming into any role, but particularly to an executive role. So there's been prolonged drought, there's been floods, and there's been the devastation of extraordinary bushfires, and many of our staff and our community will be recovering from those bushfires for the rest of their days. And then of course on top of that, there has been the significant enormity of COVID for the last couple of years, and living and leading through COVID is still a major focus for our LHD, as it is for others throughout Australia. So just turning now to give you a little bit of a flavour of where we're at in Southern. Look, it would be fair to say that we are entering into a period of very significant change and renewal. So we're very optimistic and very focused on where we'll be in the next 3 to 5 years, but in this role you'll have a key component of driving that necessary change, which focuses on performance improvement, staff wellbeing and patient safety. There's a few things specifically that are a backdrop to where we are now. We're about to launch the new strategic plan, which will give clarity for the forward direction for the next 3 to 5 years. We're in the process of implementing Elevate, which is based on the student framework, and that forms our accountability and our leadership framework to take us forward. We're having quite a major investment in leadership development training across the district. Also a major focus on staff wellbeing and engagement. We've just completed a significant survey, very grateful for the number of staff that provided feedback, and that now really informs our forward journey in terms of what are our absolute priorities around staff wellbeing. Another area of focus at the moment is a refresh of the community and consumer engagement strategy, and I'm excited about the new beginnings that that will bring. And a further area of focus is on strengthening existing partnerships. So in this role, along with me and other members of the executive, you will have a key role in forming and developing and nurturing effective partnerships that will support the renewal of Southern. Also at the moment we have the excitement of being about to move into a fabulous new hospital at Goulburn, and we're in the early planning stages of the establishment of a new $200 million regional referral hospital over on the coast at Eurobodalla. And on top of that there are other exciting capital works developments across the district that will enhance the environment of care. All of these things in our forward direction, of course, at the moment are occurring with the backdrop and the big focus around the ongoing challenge of COVID, and it's fair to say that some very challenging months are still ahead of us. So turning now to the attributes of this incredibly fabulous person that I'm looking for. So first of all, of course, you would need to have the background and the demonstrated runs on the board that gives you the expertise and the credibility to hold this senior executive role. You will be a recognised, visible, kind and caring leader of people. You'll be a fabulous communicator. You will have the demonstrated capability, capacity and passion to clear the way for people to shine. So not just your 9 direct reports, that's a big job in and of itself, but also you have a key role in ensuring and enabling the broader success of the executive and therefore the organisation as a whole. You'll be someone that will connect with the privilege of this role, and you'll be someone that will be focused on your legacy in this role. The overall environment, as I've mentioned, is very challenging and will continue to be so. It'll be critical that you will be someone that will have the steadiness and resilience to flourish in a pressured environment. And on top of all of that, you need to have a good sense of humour. So what is it that I can offer you? Well, I can offer you a senior executive leadership role in a dynamic health service in New South Wales at a time of extraordinary change, development and opportunity. I can offer you a role that gives you the opportunity to bring everything you've got to the table, a job where you can make a big difference every single day, and importantly, a job where you will be able to leave a meaningful legacy. I'm an experienced chief executive. I've been in the role for 18 months now, and I'm anticipating being here for another 5 years. So we're looking at having a very stable, integrated executive. And in my role as your chief executive, I will be absolutely committed to supporting you and enabling you to shine in the role and for you to be able to reach your own career objectives. You'll be working with a great team of executives along with a fabulous team of leaders across the organisation and a fabulous team of Southern staff who are very, very committed to where we can together take Southern. You'll have direct access to the board, and also you'll be able to contribute to the state agenda and have quite direct access to all that the ministry has to offer. So I'll be very committed to your professional development and to supporting your career growth and development. In a nutshell, I am offering you a job that will give you the opportunity to have a central role in the renewal of Southern New South Wales Health. Rob McMillan, partner with Derwent, is handling this recruitment for us, and Rob's details are on the screen. He will welcome your inquiry, and I will be delighted to hear of your interest. Thank you.